Hello, everyone, and welcome to Public Health Nursing. This will be lesson one or week one content for you. We are just going to go over with a few short slides what public health and public health nursing are and some key points to know about them. My name is Jocelyn. I will be your instructor for this course. When looking at public health, it's good to look at some definitions, but it's also good to look at the history behind it. So public health itself is as old as history. If you look back, the early Egyptians, they filtered mud from the Nile to create safer water sources for their citizens. There's several other examples of historical changes that were made as far back as the Greeks and Egyptian time. Um, Definitions wise, there is C.E. Winslow, who is one of the American bacteriologists from the late 1800s and early 1900s. He was considered a public health expert of his time, and he defined public health as the science and art of preventing disease, prolonging life, and promoting health through the organized efforts of and informed choices of society, organizations, public and private communities, and individuals. It was a great explanation of public health. Some more recent ones, though, would be the Institute of Medicine. They state that public health is fulfilling society's interest in assuring conditions in which people can be healthy. And World Health Organization also has a great one. Public health aims to provide maximum benefit for the largest number of people. When you look at those definitions that were also listed on that CDC module, what is public health? Um, it seems to have a common theme of populations. So we move from individual health to the health of a population when you consider public health, which is a really unique aspect. When you think about it, nursing in general, no matter where you work, ends up also within those definitions of public health. You will see a trend of preventing disease and maintaining health. Health promotion and risk reduction are the key factors in public health. Health promotion and risk reduction are the key things that our healthcare providers are always focusing on to be able to keep patients out of the hospital, for example, and having a healthier lifestyle outside of the hospital. Chapter 1 of your book does a great job of describing ways to prevent disease and maintain health. It also covers the cost of US dollars on um, our hospital rates versus how much how much of our US dollars go towards public health. It really is quite saddening to see the number of dollars that go towards public health being so low, when that could be the main key of us preventing these issues from happening to where people wouldn't need to be hospitalized. I think that was a really huge eye opener when I read chapter 1. So here's where we dig a little bit further in the prevention category. Level and Clark determined 3 levels of prevention: primary, secondary, and tertiary. These are definitely your core levels of prevention that you would want to know throughout all of our public health and public health nursing course. So to start, we would go through the primary prevention, which those are examples of whatever is going to promote health and protect us from disease. So examples being vaccinations, prevention of environmental health risks, carcinogens, for example, occupational hazards, trying to get rid of those, any dangers in the workplace, for example. Those would all be good examples of a primary prevention. One keynote of primary prevention is it takes place prior to the occurrence of disease or disability. So we call that pre-pathogenesis. Then we come to secondary prevention. Secondary prevention is the pathogenesis phase, so it takes place once a disease is already present, whereas that primary prevention was prior to any disease being present. So a secondary prevention would include things like screenings, early treatment to prevent any disabilities or further deconditioning. So screenings that we do in the schools, for example, eye screenings, hearing screenings, things like that. Those would all be examples of secondary prevention. The last level of prevention is tertiary prevention, and this includes disability limitation and rehabilitation, which basically means that we want to return that individual to their original um, place in society. So these interventions are not linear by any means. So somebody could be having all of these happen at once. An example would be a community nurse could, for example, be doing a primary prevention of educating about HIV prevention to the community, and therefore anyone that was interested in further information or screening, that nurse could perform a secondary prevention of an HIV screen free of questions, free of any judgment. And if that were to come back positive in any way, then the tertiary prevention level with that public health nurse would be to refer them to a physician that would be able to treat them further. That way, you are, as the public health nurse, basically hitting all three levels of prevention: primary, secondary, and tertiary. So that would be one example of the three levels of prevention that would kind of all be going on in the same type of time frame. As we look at the definition of public health, we realize that it is a collective endeavor for sure. There are multiple disciplines involved. These involve multiple individuals and multiple organizations. So these would be key players such as hospitals, academia, so USF, for example, businesses, the city health department, for example, religious agencies, the CDC. All of these different disciplines do a great job of providing that public health that we're looking for. So the public cannot be healthy without a strong governmental supportive services. And this brings in two key players for public health nursing, Lillian Wald and Mary Brewster. You have a YouTube video about Lillian Wald on our main page of the LMS. This YouTube video covers how Lillian Wald came to be the first public health nurse. Lillian Wald is not only the founder of the Henry Street Settlement, but her and Mary Brewster found ways to utilize governmental support to bring better health to the immigrant population in New York. During this time, Wald and Brewster wore official badges from the Department of Health of New York and went door to door along with other public health nurses to determine the needs of the public. They also did other things such as promoting playgrounds for children and promoting the need for public health nurses and also promoting the need for women to be able to vote for these things. And then speaking of voting, public health nurse Lavinia Dock is also very well known for her endeavors to get women to have the ability to vote. She did a great job of putting into play the reason that women should vote by mentioning the tuberculosis crisis. She was known as quoting, "Take the present question of the underfed children in New York. How many of them will have tuberculosis? If mothers and nurses had votes, there might be school lunches for all of those children."